Welcome to the Deep Dive. We're here to take the information you need, make sense of it quickly and thoroughly.
That's the goal.
Today, we are diving into something lots of dog owners worry about: canine infectious respiratory disease. You probably know it as kennel cough.
Right, that's the common name.
We've got some pretty detailed medical information here from our sources, and our mission today is simple.
Yep, cut through the jargon.
Exactly. We want you to really understand what CRAD is, what causes it, what signs to look for, how vets diagnose it, the treatments, and maybe most importantly, how you can help prevent it.
It's definitely a multifaceted topic based on this medical text, lots of layers. But yeah, we'll break it down: origin, signs, diagnosis, treatment, prevention, all the key stuff.
Okay, let's start right at the beginning then. Canine infectious respiratory disease.
So,
Fundamentally, what is it?
okay, so think of CIRD not as one specific disease caused by one specific germ. It's really a syndrome influenced by both infections and environmental factors.
Infections and environment, meaning
Meaning specific viruses or bacteria get things started, but stress, crowding, things like that, they play a role too. It all leads to cough and other respiratory signs in dogs.
So how does it actually work inside the dog? What's the mechanism?
Well, typically it often starts with a viral infection. That initial virus damages the lining of the dog's respiratory tract, the windpipe, the airways.
Okay, so it weakens the defenses.
Precisely. That damage makes it easier for other things like bacteria or even these tiny organisms called mycoplasma to move in and cause more problems, more inflammation, and the symptoms we actually see.
Like a cough.
Exactly, like the cough.
And which parts of the body are we talking about primarily?
It's mainly the respiratory system, so the upper airways like the nose and throat, and the lower airways, the trachea and lungs.
But can it get worse? Spread beyond the lungs?
In really severe cases, yes. If the infection becomes systemic, meaning it spreads through the bloodstream, you can get sepsis. That's a serious body-wide inflammation, and it can affect multiple organs. But that's, the more severe end of the spectrum.
Got it. Now, is this something dogs are born with? Is it genetic?
No, this isn't genetic. It's an acquired disease. Dogs get it from exposure to the infectious agents.
And how common is it? Where do you typically see outbreaks?
It's actually found worldwide. It's quite common, especially as you might guess, in places where lots of dogs are housed together.
Like shelters?
Shelters, yes, but also boarding kennels, training facilities, doggy daycares, even vet clinics sometimes. Anywhere density is high, and maybe some dogs have vulnerable immune systems. That's where you see higher incidences.
Okay, that makes sense. Are certain dogs more likely to get really sick if they do catch it?
Well, all dog species are susceptible. We don't really see a specific breed predisposition.
So it's not like labs get it worse than poodles or anything?
No, nothing like that in the data. Age is a factor, though. Puppies, especially between, say, 6 weeks and 6 months old, they tend to get the most severe forms of the disease.
Poor little guys.
Yeah. But dogs of any age can get it, especially if they already have some underlying airway issue, like chronic bronchitis.
What about male versus female?
Nope. No difference there. Sex doesn't seem to be a factor.
Okay. So what should owners be watching for? What are the signs?
The signs can really vary quite a bit. You might have a dog that's infected but shows no signs at all. We call that subclinical.
So they could be spreading it without anyone knowing.
Absolutely. That's part of the challenge. Then you have mild cases, maybe just a little cough. And then you have the severe end, which can involve pneumonia.
Wow, quite a range. What determines how bad it gets?
It depends on a few things. How much damage is done to the respiratory tract, the dog's age, as we mentioned, their overall health, and importantly, which specific viruses or bacteria are involved in that particular case.
And if a dog is exposed, how quickly do symptoms usually show up?
Typically, you'll see signs appearing around 3 to 7 days after they've been exposed to the infectious agent or agents.
And these agents spread easily?
Very easily, even from dogs that look perfectly healthy. That rapid spread is a key feature.
The sources we looked at differentiate between uncomplicated and complicated CIRD. Can you break that down for us?
Sure. Uncomplicated CIRD is kind of the classic kennel cough picture. It usually starts suddenly. A cough pops up in a dog that otherwise seems fine and healthy.
What kind of cough?
It can vary. Sometimes it's a really harsh, dry, hacking sound. Other times it might be softer but still dry, or it could be moist and hacking. Sometimes you see these fits, like paroxysms of coughing, that end with the dog gagging or retching, maybe bringing up a little bit of phlegm or mucus.
Anything else trigger it?
Yeah, owners often notice that excitement, like when someone comes to the door or exercise or even just gentle pressure on the dog's windpipe, like from a collar pull, can set off a coughing spell.
Okay, that sounds unpleasant, but maybe not life-threatening. What about the complicated or severe form?
That's definitely more worrying. With complicated CIR, the dog usually feels sick. They might lose their appetite, maybe just picky at first, but it can progress to complete anorexia and not eating at all.
And the cough is different.
Yes, the cough is often more moist and productive, meaning they're coughing up stuff from deeper down. You might also see lethargy, just low energy, sluggishness. Difficulty breathing is a serious sign.
Anything else?
Unfortunately, yes. In some severe cases, you might see hemoptysis, which is coughing up blood, and exercise intolerance. They get winded really easily.
Okay, so the history the owner gives is really important. What about what a vet finds on examination? How does that differ between the two types?
Good question. With an uncomplicated case, the vet can often easily trigger that cough with just very light pressure on the trachea. But when they listen to the lungs with a stethoscope, the lung sounds are usually normal. The dog otherwise seems systemically well bright, alert.
And for the complicated cases?
There, the exam findings are different. The vet might find a fever, maybe low grade or intermittent, often around 103 to 104 Fahrenheit, which is about 39.4 to 40 Celsius.
And the lungs.
When listening to the lungs, the normal breath sounds might just seem harsher or louder. Or they might hear abnormal sounds like crackles or wheezes. Those suggest inflammation or fluid down in the airways or lungs themselves.
It sounds like there are so many potential causes. Can you walk us through the main culprits, the infectious agents?
Absolutely. We generally group them into viruses and bacteria. On the viral side, there's quite a list.
Lay it on us.
Okay, we've got canine distemper virus, canine adenovirus type 2, that's CAV2, canine parainfluenza virus, or CPIV, canine respiratory coronavirus, different from the one causing gut issues, by the way.
Ah, okay. Keep going.
Then there's canine reovirus, canine herpes virus 1, canine influenza virus, both the H3N8 and H3N2 strains that you might have heard about.
Yes, the dog flu.
Right. And even newer ones being identified like canine bocavirus, canine hepatovirus, and canine pneumovirus. It's a crowd.
Wow, that's a lot of viruses. What do they generally do?
Most of them primarily infect the cells lining the respiratory tract, both upper and lower airways. This infection can cause damage, inflammation, make the cells shed, basically roughing up the airway lining.
Which sets the stage for bacteria.
Often, yes. While any of these viruses can cause disease, studies often point to parainfluenza, CPIV, and adenovirus, CAV2, as common initial actors. They soften things up. Oh, and canine respiratory coronavirus is interesting. It specifically can destroy the cilia.
Cilia? What are those?
They're like tiny hairs lining the airways that beat constantly to sweep out mucus and debris. If you lose the cilia, it's much harder to clear infections, so secondary bacterial problems can get worse and last longer.
Okay, that makes sense.
Yeah.
Now, what about the bacteria? Which ones are common players in CIRD?
The most well-known is probably Bordetella bronchoseptica. That's the one most kennel cough vaccines target. Interestingly, Bordetella by itself can cause signs that look just like other bacterial CIRD.
So it can act alone.
It can, but often it's part of a mix. Another really important one is Streptococcus equisubspecies zooepidemicus.
That's a mouthful. Why is it important?
Because this one can cause a really severe, acute, and sometimes rapidly fatal hemorrhagic pneumonia. It's a nasty one.
Yikes.
Any others?
Yeah, other bacteria can be involved too, often as secondary invaders. Things like Pseudomonas, E. coli, Klebsiella, Pastorella, other types of Streptococcus, and also Mycoplasma species, which are bacteria without cell walls.
So a real mix of potential bugs.
Yeah.
Beyond the bugs themselves, are there other risk factors that make dogs more likely to get CIRD?
Yes, absolutely. Environmental factors are huge. Poor hygiene and overcrowding are major risks. That's why it's more common in some settings like pet shops, shelters, research facilities, and, as mentioned, boarding or training kennels if management isn't top-notch.
And what about the dog's own health?
Right. Dogs that already have some underlying airway disease, even if it's mild or subclinical, maybe a congenital issue they were born with, or chronic bronchitis or something called bronchiectasis, where the airways are abnormally widened, they're definitely at higher risk. Okay, so let's say a dog comes into the vet clinic coughing, maybe feeling unwell. How does the vet figure out if it's CIRD and not something else? What's the diagnostic process?
It starts with thinking about differential diagnoses, basically. What else could be causing these signs?
And that depends on how sick the dog is.
Exactly. If the dog is systemically well, just coughing, The vet might consider things like parasitic bronchitis. Maybe they inhaled something irritating, a foreign object stuck in the windpipe, or maybe airway collapse, especially in certain breeds.
Okay. And if the dog is sick, fever, lethargy.
Then the list broadens. Could it be fungal pneumonia? Cancer in the lungs, either primary or spread from elsewhere? Congestive heart failure can cause coughing. Or even a migrating foreign body like a grass-on that worked its way into the chest.
So how do they start narrowing it
A
down?
lot of the time, a provisional diagnosis, sort of a working guess, is made based on the clinical signs the dog is showing and, really importantly, their history.
Like if they were just boarded.
Precisely. Recent exposure to other dogs in a group setting is a huge clue pointing towards CIRD.
What about lab work? Blood tests, urine tests?
They can be helpful. Sometimes, early in a viral infection, you might see a temporary drop in white blood cell count that's leukopenia.
Okay.
But more often, especially if there's significant bacterial pneumonia, you see the opposite. An increase in neutrophils, a type of white blood cell, often with immature forms present. We call that a neutrophilic leukocytosis with a toxic left shift.
Which basically means the body is fighting a bacterial infection hard.
That's a good way to put it, yes. A standard blood chemistry panel and urinalysis are usually run too, just to check organ function and overall health status.
Any other lab tests that might be needed?
If a pneumonia is suspected or confirmed, checking blood oxygen levels is important. Pulse oximetry is a non-invasive way, or arterial blood gas analysis gives more precise information. Low oxygen, or hypoxemia, tells you the lungs aren't working properly.
And imaging, x-rays.
Yeah.
How useful are they?
Chest radiographs, or X-rays, are very useful. In uncomplicated CIRD, the chest X-rays might actually look completely normal, which helps rule out other things.
But in complicated cases.
Then you often see changes. Bacterial pneumonia typically shows up as increased density, like cloudy areas, in the lungs. Often it's in a specific pattern, what vets call an interstitial and alveolar pattern, usually concentrated in the front and lower parts of the lungs, the cranioventral distribution.
Okay. What about viral pneumonia?
That might look more diffuse, spread throughout the lungs, more of an interstitial pattern, but honestly, you can see mixed patterns too. The X-rays are crucial for confirming pneumonia and assessing severity.
For those really tough or severe cases, are there more invasive diagnostic steps?
Yes. If you really need to know exactly what's going on deep in the lungs, especially in severe cases, the ideal procedure is often a bronchoalveolar lavage, or BAL.
How does that work?
It's usually done using a bronchoscope, a small camera passed down the airway. Sterile fluid is flushed into a section of the lung and then suctioned back out.
And what do you do with that fluid?
You can examine the cells in it under a microscope. That's cytology, which tells you about the type of inflammation. And you can culture it to identify specific bacteria or other microbes.
Is there an alternative if bronchoscopy isn't possible?
A tracheal wash is another option. Fluid is flushed into the trachea and suctioned back. It's less targeted than a BAL and has a higher risk of contamination from bacteria normally living in the mouth or upper airway, but it can still provide useful samples.
And why is culturing so important?
Because it doesn't just tell you which bacteria are there, it allows for antimicrobial sensitivity testing. That tells the vet which antibiotics are actually going to work against those specific bacteria. It guides treatment.
Makes sense.
Yeah.
What about detecting viruses down there?
PCR tests, polymerase chain reaction, can detect viral genetic material in BAL fluid. But according to our sources, there's still limited data on exactly how accurate or clinically useful this is for all the different respiratory viruses in dogs.
Okay. The sources also mention pathological findings looking at the tissues themselves. What can that tell us? Seems like that's more after the fact.
Often, yes, detailed pathology might be done post-mortem, or sometimes from biopsies, though biopsies aren't common for CIRD diagnosis. But understanding the tissue changes helps us understand the disease process for each cause.
Can you give some examples?
Sure. With canine parainfluenza, CPIV, the dog might seem only mildly ill, but pathologically, about a week after exposure, you might see tiny pinpoint hemorrhages in the lungs. The virus can be detected in specific airway cells.
Yeah, CAV2. The adenovirus.
Canine adenovirus type 2 usually causes lesions limited to the respiratory system. The hallmark is finding specific inclusion bodies inside the cells of the bronchi and alveoli. It's usually mild and resolves, though the cell changes can last a bit.
What about the more serious ones, like dog flu?
Right. Canine influenza virus, H3N8 for instance, can cause severe disease. Pathologically, you might see significant lung damage, sometimes with secondary mycoplasma infection and even bleeding in the lungs.
And the respiratory coronavirus.
That one is noted for causing quite marked inflammation in the trachea and nasal passages, and importantly, that loss of cilia in the trachea we talked about.
Which makes secondary infections worse.
Exactly, and that Streptococcus secuaezoepidemicus, the nasty one.
Yeah.
Pathologically, you see severe acute pneumonia, often with lots of bleeding, huge numbers of bacteria present, and sometimes even microthrombi, tiny blood clots in the lung capillaries.
Wow. And Bordetella or other severe bacterial infections.
You'd typically see signs of suppurative inflammation, meaning pus in the airways, like tracheitis and bronchitis. The nearby lymph nodes might be enlarged. Microscopically, you'd see lots of bacteria, often stuck to the mucus lining the airways.
That really gives a sense of the internal battle.
Fair.
Okay, let's pivot to treatment. How are dogs with CRD typically managed?
The first decision is where to treat them. Uncomplicated cases, the mild ones, can usually be managed at home as
This is
outpatients.
the sicker ones.
Complicated cases, or any dog with pneumonia, really need inpatient care at a veterinary hospital. They often require more intensive monitoring and support.
Like what kind of support?
Nursing care is key. Fluid therapy, often intravenously, is really important for complicated cases of pneumonia to keep them hydrated and support circulation.
What about activity? Should they be kept quiet?
Absolutely. Strict rest is crucial. For uncomplicated cases, that usually means limiting activity for maybe 2 to 3 weeks.
And longer for severe cases?
Yes, much longer. If there's pneumonia, rest should continue until follow-up chest x-rays show significant improvement, which can take quite a while.
Diet. Anything special?
Just ensuring they have access to good quality, palatable commercial dog food to maintain nutrition. Sometimes enticing them to eat if their appetite is down.
What about advice for the owner? Client education.
This is vital. First, isolation. The affected dog needs to be kept away from all other susceptible animals. They can be contagious before they even look sick and remain so until immunity develops.
Okay, isolate. What else?
Owners need to know what to expect. Uncomplicated cases should start improving within 10 to 14 days. If not, they need to contact the vet. Also, emphasizing kennel management for outbreaks is key.
You mean cleaning?
Yes, if it happens in a multi-dog place, sometimes evacuation, followed by thorough cleaning and disinfection is necessary. The sources mention specific disinfectants like sodium hypochlorite bleach, diluted 1.3 chlorhexidine solutions, or benzalkonium chloride, and allowing time, maybe 1 to 2 weeks, before reintroducing dogs.
All right, let's talk medications. What are the go-to drugs for uncomplicated CID?
For straightforward cases, vets often reach for oral antibiotics like amoxicillin combined with clavulanic acid or doxycycline. The sources give specific dosages, usually given twice daily.
And for the severe cases, the ones in the hospital?
Treatment is usually more aggressive, often involves injectable antibiotics, maybe a penicillin-type drug like ampicillin or tucarcillin, often combined with an aminoglycoside like gentamicin or amikacin,
I'll add a combination.
to cover a broader range of potential bacteria. Another option instead of the aminoglycoside might be a fluoroquinolone antibiotic, like enrofloxacin. Again, specific dosages and frequencies are important.
How long do they need antibiotics?
The duration is critical, especially with pneumonia. Generally, treatment should continue for at least 10 days after chest x-rays show the pneumonia has resolved. You don't want to stop too soon.
What if Bordetella is suspected or bacteria that might be resistant? You mentioned sensitivity testing.
Right. If Bordetella or resistant bacteria are a concern, we know that some oral or injected antibiotics don't reach really high concentrations deep in the lower airways.
And so what can be done?
In those situations, nebulized gentamicin can be helpful. The antibiotic is turned into a mist and inhaled directly into the lungs, usually done once or twice a day for a few days.
Does that replace other antibiotics?
Not usually if there's pneumonia. For lung involvement, nebulized treatment should be in addition to systemic antibiotics, the ones given by mouth or injection.
Okay. What about just controlling the cough itself? It sounds miserable.
It can be. For those dry, hacking, non-productive coughs, the ones not associated with bringing up gunk from a bacterial infection, cough suppressants can offer relief. Drugs like butorphanol or hydrocodone bitartrate are options given at specific dosages.
Any other types of meds?
Sometimes bronchodilators, like terbutaline, might be used if there seems to be bronchospasm, like wheezing, to help open the airways.
Are there meds that should not be used or used carefully? Contraindications?
Yes. Cough suppressants are generally avoided in dogs with pneumonia. You actually want them to cough effectively to clear secretions from their lungs in that case.
Makes sense. Anything else?
Glucocorticoid steroids should be used very cautiously. Maybe only considered for really severe inflammatory disease that isn't responding to anything else, and usually only after infections are under control. They suppress the immune system, which isn't ideal when fighting infection.
Good to know. Any important drug interactions to be aware of?
One mentioned is between fluoroquinolone antibiotics like enrofloxacin and theophylline derivatives, which are sometimes used as bronchodilators.
What happens?
The fluoroquinolone can increase the levels of theophylline in the body, potentially leading to toxicity. So, if a dog needs both, the theophylline dose might need to be reduced and levels monitored.
Okay, so the dog is on treatment. What kind of follow-up is needed?
Monitoring is key. For uncomplicated cases, as we said, improvement should be seen in 10–14 days. If the cough hangs on longer despite treatment, the vet needs to rethink the diagnosis. Maybe it wasn't CID or there's something else going on.
And for the complicated pneumonia cases?
Regular follow-up chest x-rays are essential. They need to be repeated until the lungs look clear and generally continued until at least 7 days after all the clinical signs have resolved completely.
Prevention seems like the best strategy. What are the key preventative measures?
The biggest factor in spread is shedding of the infectious agents in airway secretions, coughing, sneezing, nasal discharge. So prevention focuses on reducing that spread.
Which means hygiene and avoiding crowding.
Exactly. Good hygiene protocols, good ventilation, and avoiding overcrowding are paramount in kennels, shelters, daycares, vet clinics, anywhere dogs congregate.
And vaccines, how effective are they?
Vaccines are a really important tool. Core puppy vaccines include modified live vaccines against canine distemper virus, CDV, and canine adenovirus type 2, CAV2. These are started young, around 6 weeks, and given in a series.
What about vaccines specifically for kennel cough?
Yes, there are vaccines targeting Bordetella bronchoseptica and canine parainfluenza virus, CPIV. There are intranasal or mucosal versions squirted up the nose.
Why about the nose?
They stimulate local immunity right where the infection often starts. Plus, they can be given to very young puppies, like 2–4 weeks old, because maternal antibodies don't interfere as much with the intranasal route. These usually require annual boosters. Mature dogs might just get a single annual intranasal dose.
Are there injectable versions too?
Yes, there's an inactivated injectable Bordetella vaccine. It requires 2 doses initially, 2 for 4 weeks apart, starting around 6 to 8 weeks old, with another booster later. And there's also an inactivated canine influenza vaccine for both H3N8 and H3N2.
Is the flu vaccine considered core?
Not currently considered core for all dogs, but recommended for dogs at higher risk due to lifestyle shows, boarding, travel. It helps lessen the severity and duration of illness if they get infected, but might not prevent infection entirely. It also requires 2 initial doses and stimulates antibody production.
Okay, last question. What's the typical outlook? The natural course and prognosis?
For uncomplicated CIRD, if left untreated but the dog is rested, it usually resolves on its own in about 10–14 days. Rest and avoiding excitement really helps shorten it.
And the severe cases?
Severe cases, especially with pneumonia, take much longer, typically 2 to 6 weeks for recovery. Unfortunately, fatalities can occur. Usually that involves very severe pneumonia affecting large portions of the lungs, leading to respiratory failure and potentially multi-organ failure due to sepsis.
Right, so wrapping this all up, it seems canine infectious respiratory disease is, well, complicated. Lots of different causes, a whole range of symptoms from mild to severe, and various ways to diagnose and treat it.
That sums it up well.
And early recognition, getting veterinary care quickly, especially for puppies or dogs with underlying issues, seems absolutely critical.
Definitely. And prevention through vaccination where appropriate and just good hygiene and management practices in multi-dog situations is really the cornerstone for control.
It really is. Thanks for breaking all that down.
My pleasure. It's complex stuff.
It leaves you with a thought, though. Given all these different viruses and bacteria, the primary ones, the secondary ones, how might research move forward? Finding even more targeted ways to prevent or treat CIRD in the future. Maybe looking into the latest veterinary infectious disease research would shed some light on where things are heading.
That's a great point. Ongoing research into diagnostics, vaccines, and maybe even antiviral or more targeted antibacterial therapies could certainly change how we manage CIRD down the road. Definitely something worth keeping an eye on.